Good Friday morning, everyone. I'm Dr. David Wild, Vice President of Performance Improvement here at the University of Kansas Health System, in for Dr. Steve Stites this morning. We're coming to you from the Dolph Simons Jr. Family Broadcast Studio. And today, a special guest with us all the way from Arizona, Dr. Vince Key, the head team physician for the Royals, an orthopedic surgeon and sports medicine specialist here at the health system, is at training camp. He'll join us in a bit to talk about spring training during a pandemic, what looks different this year besides Carlos Santana. But first, Dr. Dana Hawkinson, our Medical Director of Infection Prevention and Control, is here with our numbers. Dana, how'd we do overnight?
You know, we did pretty good. You know, Vince is out in Arizona. I think he should have helped Tiger. It's a quick trip to LA,
drive.
So he would have been very helpful for that. You know, we're doing pretty good. Got kind of concerned early in the week when our acute numbers had gone up. Acute numbers today, 23 active infections, which I think is astounding. 10 of those, though, are in the ICU, so almost half, but only 2 on the ventilator, so that's a good thing. 32 in that recovery period, so I think we're doing pretty well overall, 55 total patients. Hayes is doing pretty well as well, 13 total patients with 8 in the active phase and 5 in the recovery, so. Overall, too, I saw in Kansas City, from yesterday's data in the Kansas City Star, felt just under 200 cases per day for the rolling 7-day average. So, you know, again, I think as a community, we have done pretty good and been very fortunate compared to some of the other cities in the nation.
Very true. Well, before we jump too much into our discussion today, Jessica, are there any reporter questions on the line this morning?
We're checking right now. Go ahead with your question. No reporter questions. It's all you.
Very good. Well, let's move right to Dr. Key. How is Arizona this morning?
It's warm.
It's warm.
It's not bad. Hey, Dana, I know you mentioned Tiger. It's funny because where he was taken initially was Harbor UCLA. It's actually right down the street from where I trained in LA. So, and then he got transferred over to Cedars yesterday. So that's where 2 of my kids were born. And actually, the chief of trauma there actually was a resident 1 or 2 years behind me. So for his initial injury, he got treated where he needed to be treated because Harbor is a county level 1 trauma center, one of the best around in LA. So once he got stabilized, then he can go over. I call Cedar Sinai the country club, so he can go over to the country club and convalesce. So, but anyway, Arizona's good. Everything is ready to roll. Obviously, it's a little bit different here with COVID. The way that we do things, we really try to be really proactive in terms of what we've done. We've been preparing for this since the end of the season. So through Major League Baseball, we've been trying to see how spring training is going to look like. We're trying to see even how the season's going to look. So there are a lot of things that are a little bit different. We are definitely social distancing. Even the way we eat, usually we ate inside, now we eat outside. The tables are spread apart. We get tested every other day. In fact, I have to get tested today. We even have our little monitors. Those just came in. So we'll have monitors on the players, monitors on the staff. So I think we're doing everything right here.
You know, Vince, there have been some pictures that have shown things being very different, like weight rooms being moved outside where possible, and the use of really every field for stretching, and no minor league players, and so using really multiple clubhouses to spread the team out. Those are the things that were easily seen visually, sort of in the paper or online. What other sorts of things, you know, you mentioned the eating, for example, what other sorts of things outside of masking and physical distancing are noticeably different in Surprise this year?
Well, it is. It's even, we have rehab up on the upper fields in a covered environment. Since it's so warm here, we're doing some PT outside. You're right in terms of the weight room, but the way that weight room is set up, it's actually been set up for that all along. It's just the fact that now we're using it. Coming in and out, like you said, we're using the minor league and major league side. The minor leaguers won't come in until the first week in April. So spring training is going to be longer. It's usually 6 weeks. Now it's going to be 6 weeks for the major league guys and then 4 weeks for the minor league guys. So it's a total of 10 weeks.
And normally, spring training is sort of almost a pilgrimage. You get a lot of media and a lot of spectators. Is that the same this year?
No, not at all. We only have, I think, 2 reporters from the Star that we've even seen. So in talking to Mike Swanson, our VP of media, there's really no media here outside of those guys with the Kansas City Star. Usually we'll have ESPN come in, Major League Network come in, but there's none of that here. So all of it is via Zoom, Skype, or whatever platform that they have.
And as we get closer to game time, do you have an idea of what will be different for the players and really around the ballpark this year as the season progresses?
I think it'll be, hopefully, in terms of obviously fans being allowed in, hopefully that's going to be the case. I know out here they had Kansas State playing baseball out here in a tournament using our stadium, and we had fans there. We had the parents out there. I know during the the games out here in spring training, they're going to have, I think, about 20 to 25% of fans. They'll be all spread out. So that'll be good. And I think that will hopefully manifest itself to the regular season. Everything else is pretty much what we went through last year. Like I said, the template that Major League Baseball set for us to even get us through the season last year is pretty much the same. There are some little tweaks here and there, but overall it's pretty much the same.
You mentioned every other day testing, a lot of the other things that look different for the staff and the team. If I remember right, we had really a week or so, maybe 2 weeks of spring training last year, and then everything kind of halted. So this is really new. All of this is new in spring training. What we learned during the season last year might be applied, but this is all the first time for the teams while they're preparing for the season, right?
Yeah, absolutely. It is new for them. Again, it's new how they prepare to come into spring training. A lot of guys prepare a little bit differently. It's going to be a little bit different ramp up. I think it's good in the sense that you don't have a ton of baseball players here. So there's a little bit more emphasis, one-on-one time with players and coaches. On the medical staff side, it's been pretty much the same. I mean, it was, at least for me, it was less physicals that I had to do initially. But just because of everything that went down in Texas with the snow and everything, I actually had to do physicals for the Texas Rangers next door. So, that was the only thing that was a little bit different for me, that I had to do physicals. I was the team doc for both teams there for about a day or two.
Interesting. Yeah, the curveballs of this year continue, don't they? I mean, the weather on top of everything else. So the real important questions, what do you think about the team as things are shaping up?
Here's what I'll say. It's a little bit different energy this year. The one guy we miss is the guy over my shoulder, Alex Gordon. Alex and I have texted a few times. I told him I missed him. I miss he has a little bench or his locker. I think Whit Merrifield has his locker now. But the energy is different. I remember Nicky Lopez coming into the training room, and he said there's a little bit more juice this year. And I think it's a good mix of old and new. It's almost like getting the band back together again with Mike Minor and Wade Davis and Greg Holland back. And, we have some of the guys back from 14 and 15 to be able to blend with the Brady Singers and the Bubic's and guys like that. So, and then we get the addition of someone like Carlos Santana. So we would much rather him on our team than playing against him, given the fact that every time he played in Kauffman Stadium, he hit about 2 or 3 bombs a game. But we've added some new pieces. Michael Taylor out in center field. Benintendi from the Red Sox. So we've added some nice pieces, and I think we're going to be a little bit better than most people think. I'm no prognosticator saying we're going to make the playoffs or anything like that, but it is a little bit different energy this year. This is my 11th season taking care of the team, but it's a little bit different energy this year than it has been the past couple of years.
I think it's good to hear that from the outside watching. It sure looks like the sort of stability now with Santana being at first base and allowing the lineup to really be set. Some of the other additions you mentioned, having center field really covered with Taylor. Lots of things seem to be falling in line as the sun is creating.
Yeah, the sun's killing me.
It's going to be a nice front light, though, once it comes down.
All right. Well, we'll give you a break
Looks
for
good.
just a second. We'll get to some community questions. I'm sure there'll be some things that we'll toss your way. But Jessica,
Are you growing a beard, by the way?
a little bit.
Okay, that was my question of the
There
day.
you go.
Looking good. All right. Okay, so first
Awkward.
question is, my family had COVID at Thanksgiving time. Do we have immunity now?
Dana, you want to start?
Still.
Yeah, and certainly you can pick up. I would say there's probably partial immunity. We don't know to what extent. You know, what we're learning more and more is that with cases of mild to moderate disease, you probably don't have as much as immunity. But what does that mean? Is that T-cell response? Is that antibodies? There's pretty good studies showing that if you have more severe disease, you typically have higher antibody levels. What is the relationship of that? What does that mean? We don't really know. Still, the guidance is that, if you've had COVID-19, you should probably still have immunity for at least 90 days. Now, what does that immunity mean? There was just an article published recently in MMWR, I think, that looked at reinfections in a nursing home. But this was several months out. This was a lot longer than 90 days. So a short answer to that question is you probably do have some immunity, but we don't know what level of immunity that is, and we still don't know what happens if you get reinfection on the individual level. So we are still learning that.
Now that county health departments have control of the vaccine and will only let hospitals vaccinate people living in their specific counties, is this going to slow down the access to the vaccine? What happened to go anywhere and get your shot?
So lots of questions in there. I think realistically, one of the things that we've learned to be really comfortable with over the last year is that the story today isn't the story tomorrow. And the current situation where counties are receiving allocations and then trying to figure out how best to manage getting those doses into the residents in that county is really a function of the fact that inventory or supply is a challenge. And I think once that goes away, as we get more doses flowing into the United States, as manufacturers ramp up, as we get at least anticipate getting a Johnson & Johnson EUA this week, that we'll have a better inventory, and I think then those things will sort of relax just a little bit. At the end of the day, what we know, even with these restrictions, county by county or based on state of residency, is that doses are not sitting on shelves. So it's not slowing anything down for individuals. Or really slowing the population. And that, I think, is the end goal. Right now, when we don't have enough doses for everyone who wants one, there are limitations one way or another, and I hope soon that we'll be out of that situation.
Yeah, I think so, and I agree. We've seen evolution in this where the first allocations were to health systems, dictated by the state health department, and now it's more of the county health departments. But I think there's going to continue to be evolution, just as you said, as supply increases, especially if J&J does get approved. That will help a lot.
I have a media question that just came in from Channel 9 from Donna. Can we ask Dr. Key if they plan to vaccinate players, or is that going to be up to each individual?
As it stands right now, it's hard to say what's going to happen. I don't think that there's not a plan in place through Major League Baseball in terms of vaccinating the players. I think the players at some point will probably get vaccinated, but obviously, I think they're down the pecking order. as long as we do our thing in terms of social distance and everything that we've done to try to mitigate our risk here, I think there are more important people that need to be vaccinated first, and then we get to the players. So there hasn't been a plan in place in terms of MLB, and I know in our organization, obviously people who fit the criteria have been vaccinated in terms of age and comorbidities and things of that nature. But other than that, there really hasn't been a plan in place yet.
And also, Dr. Key, Isaac wants to know, as for the Royals, do you know if the team will request proof of either a vaccination or a recent negative COVID test in order for fans to enter the stadium? Do you know that information?
I don't know that yet. I know Nick Kinney, our head trainer, has been in contact with people at the city level. I can certainly ask him that in his conversations, but I have not heard that as of yet.
One of the things we know in that regard is that the success of the suite testing at Arrowhead is playing into the conversations about whether testing may be appropriate in other venues that have suites where you can't separate out groups of seats. And so I would not be surprised to see that if the suites were to open at the K, that there would be some sort of testing or vaccination sort of proof policy. But I'm not so sure that it makes sense across the whole stadium for the large population if you can space seats out. So I wouldn't be surprised to see a little bit, but I would also be surprised if it were everyone coming into the stadium sort of answer in the long run.
I think the nice thing about that is the K is outside,
Yeah.
not the suites, but most of the seating, which is a nice thing.
Which vaccine is safe for someone who has severe anaphylaxis? My reactions stem from food and environmental triggers.
Yeah, if you see an allergist, I would talk with them. But the current guidance is that food allergies or environmental triggers really don't play a part in this. So both of these vaccines are going to be safe. But for your individual health, please talk with your medical provider about that. But overall, the guidance is really that it should still be safe for you.
What is the role of T cells in COVID-19 infection? I've read that even without antibodies, our T cells can remember the viruses we've had. Does that offer protection against COVID-19?
Yeah, we actually think T cells play a substantial role. T cells play a substantial role in our immune function in general. CD4 T cells, which help with immune signaling to signal with cytokines and things of that nature, and then CD8 cells. T cells generally, the way to think about it is either cell signaling, so releasing of cytokines, and communication with other immune cells to really coordinate the immune response. And then you have the T cells that also kill cells that are infected with virus, so you're essentially shutting down viral protection, whereas the antibodies really help through the bloodstream to get the virus that is out in the bloodstream to help prevent infection of further cells. So that is the two arms. T cells are extremely important. We know that even people with who have recovered and have no antibodies that are detectable have that T cell response. And so it is thought to play a very, very important role in the immune function and getting over COVID-19 because of that. So T cells are extremely important, and we have seen in the Moderna and Pfizer vaccines that they have looked at T cell responses, and you do get fairly good T cell responses with those vaccines as well.
So the translation there from immunologists to maybe the general public is, I think, tell me if you disagree, Dana, but that the immune system is complex.
Yeah.
And any single portion measuring its activity is not a marker of immunity. So we've talked about that a lot. Just measuring antibody levels is not enough to say whether you have immunity or you don't. That there are T cell functions and memory B cell functions and a lot of other things that happen that result clinically in this response where our body says, hey, I've seen you before and you're not going to infect me again.
Yeah.
And those things all play together. And so, yes, T cells play an important part in that conversation. And we have proof that our vaccines are generating T cell responses like natural infection or natural immunity would. And those are all good things.
Yeah, 100%.
There you go.
So we know we hit the 500,000 death mark this week for COVID-19. 675,000 people were killed by the Spanish flu. back in 1918. There were no vaccinations for the Spanish flu. What does that modeling show for total expected deaths by COVID-19 now that we have the vaccines?
Again, lots of good questions in there. Some are assumptions and unknown still. Some we have a pretty good sense of what the impact will be. First, I don't think that there's any real thought that we're not going to top that 675,000 number for deaths from COVID, from this pandemic. So that's the first sort of answer in there. Second, vaccines, and we've said this a lot, vaccines don't prevent death, vaccination does. And so just simply the fact that we have 2 and hopefully 3 after today candidates, vaccine candidates that are available, as we all have learned, is something very different from vaccination of everyone who wants it, whether we're talking about people in the community who have risk factors, whether they be age or coexisting disease, or even, as Dr. Key mentioned, the fact that at some point we will get to players, because it is important to do that since they're around so many people and it's such an important part of sort of our culture, but that right now there are more important people, or at least people who would benefit more as far as reducing their risk. So what does that mean when we understand how vaccines fit into modeling to see where we think we're going to land? Well, as of yesterday, we're doing about 700,000 new vaccines, new first vaccines per week, which is actually down as we've had more second doses to give nationwide. And at that rate, it's estimated now that we're looking in, say, mid-August, before half of the population has a first dose, if things don't change. And sometime in mid to late February, before 90% would have the first dose, which means the impact of vaccine on deaths is going to sort of ramp up over a long period. But the whole reason we focused on those who are more likely to die, not just those who are more likely to have disease, with early vaccination, right? Those that live in long-term care facilities, those over 65, the odds ratios of death from infection are much higher for those groups. That's the reason to focus on them. Even over those with comorbid conditions, for the most part. There are some things that I think have a high odds ratio as well, some very specific diseases. But that's all going to say the vaccination strategy has been aimed at blunting the deaths of those who are most likely to die early on. So a big portion of that benefit in the modeling happens now. We're seeing it already. We're seeing that in hospitalizations even, I think, right? We've mentioned we don't see the hospitalizations from long-term care facilities, which were a big part of our early on deaths anymore. We're not seeing that nearly the same way we were even a couple months ago. So long-winded answer saying, of course, there's an impact. It varies over time. It will continue to grow, but it's not going to be a big enough impact fast enough to keep us from hitting that 675,000 number.
And a couple things, those deaths from the influenza in 1918, which again, I think it was more than just one calendar year.
Yes.
Also, a large proportion of those deaths were due to probably bacterial pneumonia, which occurred after influenza, where we didn't have antibacterials. We have good antibacterials now to help prevent that. But when you say, it's going to be this date or this date till first dose, does that include Johnson & Johnson, which potentially is that one-dose series?
So that is if we continue with the same number of first doses per week that we're seeing now. So yes, any change either in vaccination administration schedules, a single dose or a change to the existing, or any new inventory coming in because of another authorization will change that and improve.
Positive effect, hopefully. Okay.
A question for Dr. Key. What precautions do you recommend for youth baseball and high school baseball and other sports as they start back up this spring?
I think, again, I think the main thing is doing a lot of the things that we've been doing before. I mean, it's kind of hard sometimes at a baseball game because there's stands and things like that, and people are standing around, and especially at the youth baseball games. But again, it's a matter of the same stuff: social distancing, wearing your mask. If you had hand sanitizer with you, using that. being able to pack. I know a lot of parents like to bring snacks and things of that nature, which is fine, but it's gonna be a little bit more cumbersome because you have to individualize those things. Same way that we do down here in Arizona is that our meals are packaged totally individually. So I think those are the things that we need to do. It may even be that kids limit the number of games that they play during the summer, not going to as many tournaments. At least for this summer, that may be something that needs to be done. So I think those are the little things that we can do to help mitigate our risk.
And I would add, the biggest things I see is if you can get everybody in that dugout to mask, I think is important. Because they're just centered together so closely, coaches and players.
Any advice for those of us who are primary caregivers who are unvaccinated to our elderly vaccinated parents? The continued stress and fear of giving them COVID-19 is starting to take a toll.
Yeah. Well, I know that we have very good efficacy in these vaccines. And what I mean by efficacy here is, again, prevention of severe disease and mortality. I think if there's still concern, if you are masking before the vaccination, I think masking is extremely important. Keeping that distance until you need to be close to them to perform any functions or what that might be. But I think doing those things is really going to be the most helpful thing.
As we said over and over and over again, we knew how to prevent transmission of COVID before vaccine. Vaccine is a tool that we have available to us and a very important one, but even in a circumstance where people are unvaccinated, we know that physical distancing and masking and good hand hygiene and all of those pillars of infection prevention that we've talked about now for a year play a part still. And so you can keep your family safe. Totally understand, though, the concern, the fear, and don't discount that at all.
I read that the mortality rate in the ICUs between March and October of last year went from 60% to 36%. Is that because of a change in the virus or in treatments? And what can we expect from the new variants?
Loaded questions.
Yeah. Well, I'll start because you've had a very good answer and explanation for the non-pharmaceutical reasons. So certainly for pharmaceutical reasons, we do understand. Remdesivir has helped. Dexamethasone has helped. There's just been a new study, the recovery study, that was final analysis published in the New England Journal of Medicine either yesterday or today, that shows an improved mortality rate for those people that meet that criteria for steroid therapy, dexamethasone. And then, of course, the anticoagulation, helping prevent or treat those blood clots, either large blood clots or micro blood clots that may occur in your lungs. So those drugs have certainly helped. But also, I think one of the things is also, initially there was a big push to intubate people as soon as possible, get them on the ventilator as soon as possible. That theory, that thinking has changed. Now we're trying to prevent getting on the ventilator as much as possible until the last possible second, and just using non-invasive ventilation, which is basically high amounts of oxygen through an oxygen mask. And then you had other reasons that...
Yeah, there are a lot of reasons, I think, but what you're saying, Dana, that we learned a lot in our treatment is very true. Just like we learned a lot about how to prevent spread. You really watched this unfold, how rapidly we learned about a completely novel, remember we talked about this early on, for a novel coronavirus, a disease that we as a world had never seen before. We learned very rapidly how to keep it from being transmitted, and then learned after that how to manage treatment. And those things are very true. One of the questions I think that was buried in there was, is there a change in the virus? And I think we can say, well, no, the virus is no less likely to cause disease or no less deadly than it was. We just know more about how to prevent spread and know more about how to treat. And preventing spread to those who are more likely to die is one of the reasons that we have a lower mortality rate, and then improvement in treatment is another.
And then one of the references you've mentioned before was talking about it's not an overwhelming of our healthcare system that has helped.
Very true.
Our nurses, respiratory therapists, physicians are not as overwhelmed right now and became less overwhelmed as the pandemic went on, especially here locally, than it was. But as you've talked about, those places where they are overwhelmed and there's capacity issues and there's lack of important drugs to keep people sedated and comfortable on the vent, then you also have a raise in your mortality rate as well. As far as are the variants more deadly? There's been some information out about the UK variant being more deadly, possibly the South African variant. In the scientific community, virologists, still want to see the full subset of data. We still don't know that for sure, but that is certainly what's being touted out there, is there's probably a higher risk of mortality from some of these variants. About a third, probably 1.3%, 1.3 risk from the normal variant. But now we have some New York variants that we've seen talk about and some California variants, and I haven't seen a lot of information about increased mortality from those. So again, we are still waiting for the full data on any change in mortality or the burden of disease with those.
If the vaccines result in more asymptomatic or less symptomatic cases, will contact tracing still occur? Is there still a reason for the public to know where the outbreaks happen in the future?
I think we'll have to start with saying until the majority of the population is vaccinated, there will still be a need for contact tracing. And we will still need to talk about where we are seeing transmission to make sure that those that are unvaccinated, because remember, the thought is right now, with no approved vaccine for children under 16, it will be some time before we're really even talking about vaccinating children. So we're going to have a lot of reason to pay attention to where disease spreads for a long time still. That need isn't going to go away. But I think we are anticipating better guidance from the CDC on how to manage things for those who are vaccinated and for how long after a vaccine you don't need to worry about exposure as far as a significant risk of transmission.
Yeah, but I think contact tracing and looking and identifying outbreak situations are extremely important, especially if you have congregate living situations like nursing facilities or prisons. But then also I think the local dynamics in your community. If there's high rates of spread in a certain community, does that mean we can't go to the K and watch the Royals? I don't know. So I think contact tracing and the ability to identify surges or outbreaks is going to still be extremely important moving forward.
I've read that long haulers have received some relief from their ongoing symptoms after getting vaccinated. Is this true?
Yeah, I can't answer that. I don't know. I don't see a mechanism for that. That would be great. We know that, COVID-19 long haulers or long COVID, and now it's called post-acute sequelae of COVID-19 or PASC, P-A-S-C. People suffer brain fog, fatigue, shortness of breath. But I'm not aware of anybody who's had improvement after vaccination. But certainly, if you've had COVID-19, we do recommend that you still go get your vaccination.
When will the vaccine receive full FDA approval instead of emergency use authorization approval? What will that really mean?
Well, as far as when, I don't know the answer to that question. The process looks very different for full approval than an application for an EUA. So a lot more goes into it for controlled studies for use in pregnancy, which I know we've talked about. Those studies are happening now. Also understanding if there'd be an application for children, and again, for most vaccines there are, so those studies would have to be done, and a larger long-term safety profile. So we know the safety profile in the short term, and we believe from everything we've seen that there really is no safety risk with any of these vaccines that have EUA. But we'll want to know that in large populations and for longer than 3 or 4 months of follow-up. So those things have to happen first. Timing is hard to know.
Yeah, I don't think there's any set time frame. But once that does happen, when and if there is approval, then we can start talking about questions that have arisen. When are you going to make healthcare workers? When is it going to be mandatory? Well, we have to understand that influenza vaccination is mandatory, but that is an approved vaccine. So once that happens, then we can start to talk about employers. And there was a question today about the Royals and having their players vaccinated. So I think once there is approval, which Dr. Wild had just said, we don't know exactly when that'll be. But once there is approval, then you will start to see employers start talking about possible mandatory vaccination at that point.
Can I sneak in a couple extra questions that came in this morning? Sure. Okay, so Janet wants to know if you would know, why did the Missouri COVID vaccine form ask if I had received any other vaccinations recently? Are there any known interactions? She's considering getting the shingles vaccine.
Yeah, so there is guidance that has come out from the CDC about you want to space your any other vaccination from the COVID-19 vaccination by 2 weeks. So if you get one, say shingles, don't get the other one, don't get COVID-19 for 2 weeks, or if you get COVID-19 vaccine, spread it out for 2 weeks. There's no good real data to support as to why, but again, the safety and efficacy of giving those vaccines so close together is unknown. It's probably safe. I know that we've had to do that in a few instances here at the health system when people have recently got a vaccine. A couple days later, they did get the Moderna or Pfizer vaccine. They did fine, but currently the guidance is just if you can, try and space any other vaccine apart from COVID vaccine by 2 weeks. But we know that with other vaccines, for instance, when I see liver transplant patients in my clinic when they're getting evaluated, we certainly give 2, 3, sometimes 4 vaccines on the same visit. So that can happen with other vaccines. It is perfectly safe. Again, this is just so novel with Moderna and Pfizer right now that is the guidance.
One last question. Renee wants to know when someone in their mid-40s in Johnson County might reasonably expect to get vaccinated. Do you know the magic answer?
Well, mid-40s in Johnson County are based on really the Kansas plan anywhere. I would say, if I had to bet, summertime, when that will really be sort of open season for someone in that sort of age group and without significant comorbidities, assuming, of course, that, right, you're not in an industry or an occupation that would allow you to get vaccinated in an earlier phase. So the example we've used regularly there is the focus on K-12 educators now to be able to maintain the school systems. That's a sort of a newer population of people who hadn't been really focusing on, can I get it now? And there are some questions. But in general, I think I would say I'd plan on sometime in the summer, not yet this spring.
All right.
All right. Well, thanks for a great series of questions today. On Monday, James Stowe with the Mid-America Regional Council and Jana Jackson, our call center manager here at the health system, explain how those of you who lack computer skills or hardware can get in line to get the vaccine. Bring your questions and have a pen and paper ready for the resources that we'll share. As we wrap up today, Dr. Key, any final thoughts?
Hey, I think this season is going to be a great season for us. Like I said, I think people are going to be excited. We're excited on the other side we've been with the Chiefs. I think now it's time for us to bounce back. We had a good season last season rolling into the off season. And I really think that, again, we're going to surprise a lot of people. We have a tough division, but we're going to surprise a lot of people, and we're going to be really competitive this year.
Yeah.
Dana?
Stay safe, Vince, and look forward to you and Joe and Nick keeping all the Royals safe and getting them back so we can, hopefully everybody can get out to the K and see them. The weather is going to be nice this weekend, especially Saturday, so I'm sure people are not going to be bundled up at home anymore. If you can get outside, get some activity, but please, if you otherwise go places, eating, restaurants, any place like that, please continue to do those measures of infection prevention that we always talk about. Distance, wear your mask, try not to mix your bubbles because we know that we want to keep our restaurants open and everybody in work, but we can do this in a thoughtful manner and keep everybody safe doing it.
Yeah, I think that's a great point, Dana. I'm excited actually for the first time because mainly because we've had time to think about it a little bit, but excited for baseball season. I miss sitting in the sun on the first base side. Sometimes it's a hot seat, but I've enjoyed really my whole time in Kansas City being able to go every year in the springtime to the K. And I'm hopeful, as you mentioned, that if we continue as a community to do the things that we know how to do, the things that we've done so well really throughout the last year, that we can continue to open things up. Maybe not exactly in the ways that they were before all of this, but open things up and enjoy them. And I hope that means a nice, safe trip to the K sometime here this spring. Vince, take care out there in Surprise. Have a good time while you're there, but be safe. And wish the same to everyone here, as you said, Dana, as we enjoy the nice weather here this weekend. We will see you next week. Thanks.